Live from ABC 7, Eyewitness News in high definition.
Doctors are calling Justice Ginsburg's surgery today a shot at survival, and they agree that discovering the pancreatic tumor as early as they did was an extreme stroke of luck.
Health specialist Denise Dodor has more on what local experts are saying about the prognosis and the treatment of pancreatic cancer. Denise.
Well, we all know it's a formidable cancer, a real tough one. Initial reports say the justice's pancreatic cancer was spotted on a routine screening, but doctors say this type of cancer usually goes a long time before being diagnosed. The fact that Ruth Ginsberg has had colon cancer may have led to this early discovery.
Justice Ruth Bader Ginsberg is one of the few pancreatic cancer patients fortunate enough to have been diagnosed in time to undergo surgery. Ginsberg's doctor discovered the cancer in a routine exam, but UCLA medical oncologist Randolph Hecht says pancreatic cancer is so uncommon it's not practical to do CT scans on everyone.
There's no evidence that whole body scanning improves people's survival. There's a lot of question about it. It's actually kind of fallen a little bit by the wayside because people are worried about the radiation risk.
But because Ginsberg had colon cancer before, Dr. Hecht says she probably undergoes regular scans.
There, it does actually make sense to screen, because in colon cancer, if you find the cancer coming back in an early stage, sometimes you can cut that out for cure. So therefore, it makes sense to do scans, and they may have found this incidentally.
Her tumor is reported to be small, about 1 centimeter.
Even when caught early, the odds of surviving pancreatic cancer for 5 years is just 37% according to the American Cancer Society. Compare that to catching breast cancer early, where the odds of survival are about 100%.
Pancreatic cancer is a bad disease. There are about 30,000 cases each year of pancreatic cancer and about 30,000 deaths each year from pancreatic cancer.
Given what doctors tell us about her case, Ginsberg appears to have a good shot at survival.
There's still a decent chance that it would come back. I look at it the other way, that she probably is in the best possible group of people with pancreatic cancer.
There's no early detection test for pancreatic cancer. Vague indigestion may be the only early sign. By the time symptoms such as yellowing skin, itching, weight loss, and abdominal pain appear, the cancer is spread. Smoking and a family history of the disease are considered the top risk factors. But doctors know far less about this cancer than other solid tumor disease.
We have a long ways to go in finding it early. We have a long ways to go in treating it once it's spread.
One study underway is looking at immune therapy to block the cancer's return. And UCLA's Dr. Hecht says researchers are investigating whether DNA and protein screenings could help with early detection. There's a great resource for people diagnosed with pancreatic cancer and their families. It offers support and the latest findings in research. You can find the Pancreatic Cancer Network by going to abc7.com and clicking the See It on TV link.